are protected from this virus as we move forward. With that, I will turn it back over to Executive Director Ryan.
Thank you, Scott. Well, in summary, we really are in a good place. The state is prepared for a winter wave should immunity wane next winter. If there is another variant of concern that emerges, but we still do want people to get boosted or get immunized if they are unvaccinated. This will certainly help us as we live with COVID-19. And we really just want to thank the people of Colorado for their diligence, for practicing safe behaviors and listening to public health guidance and getting vaccinated. And yes, who can believe it's been 2 years, but we're very optimistic at the state. And with that, we have a few minutes for question and answers. I will turn it back over to Brian to help facilitate that.
Thank you, Executive Director Ryan. We will open things up for media Q&A at this point. We can use the raise hand function. You can find that feature along the bottom of your Zoom console. Let's start with first questions first. If we have any time allowing at the end, we can circle back for follow-ups or second questions. Please state your name and outlet before asking your question. And if there's anything we're not able to get to here today, please email us at media_info@state.co.us. Let's go ahead and get started with Sarah Flower. Go ahead, Sarah.
Hi, good morning. Thanks so much for taking the call today. I'm curious too, this is Sarah Flower with KDUR. When we talk about this maybe a surge coming on while we're enjoying this lull right now, is there a metric that the state is looking at, whether that's positivity rate or hospitalization, that says we've got to switch gears into surge mode? Thank you.
Yeah, well, I'll start if I can. Certainly, it's going to be a combination of measures, and CDC is actually working on some new types of measures for what we might be focusing on. We'll be, of course, looking at positivity rates, but they may not be what they used to be as fewer people get tested or use home testing and don't report into the state. That means we'll be looking also at hospitalizations, what we're hearing from our emergency rooms and our hospital systems. Are they seeing more respiratory illnesses? I think it's an important message for all Coloradans to remember that since we don't have a lot of COVID in the community now, if you do become ill, we would like you to go get tested. And if you test positive with a test kit at home, please consider getting tested with a PCR test that would be reported into the state. I think it's all of our duty to be looking for any sign of new COVID cases. And if you have symptoms of a respiratory illness over the next year, please go in and get tested so that we're counting you and we're capturing the data you're providing us as part of our tracking system.
And I'll just say, part of Colorado's data-driven response, our state epidemiologist daily has a dashboard that she updates where we're able to see number of new cases, number of new hospitalizations, number of deaths, percent positivity of tests. And over time, you can really see trends and you can tell when things are starting to increase and how quickly they're starting to increase.
All right, let's go to Alex Rose. Go ahead, Alex.
Hello, thanks as always for hosting this call. Obviously, as we shift to the endemic stage, that wastewater surveillance system is going to be key in detecting community spread, especially if people are kind of lulled into a sense of comfort and maybe not necessarily going out to get tested proactively as much as they are when levels are high. It's great that you guys have expanded from 21 facilities to 43, but looking at the map, there are still a good amount of communities. I'm thinking specifically on the western slopes like Grand Junction that aren't necessarily, it looks like, signed up for this stuff. So what is the state doing to expand wastewater facility testing, and what are you guys doing to make that system more robust as we shift into the endemic stage?
Take that one. So we are actively working to increase the number of facilities that are submitting samples to us. We have additional capacity. So it really is just establishing these relationships and getting additional facilities looped into the entire logistics program of bringing samples in. We're also exploring the opportunities to do additional testing more at the facility level or building level, which would give us a window into some of the micro watersheds instead of just the community-based surveillance. So this is an ongoing expansion. We're at 41 sites right now. We look to see that increase over time.
All right, let's go to Meg Wingerter.
Hello, this is Meg from the Denver Post. I had a question. You know, you've talked about if you're vaccinated and boosted and a relatively healthy person, just go ahead and live your life. But if you're, relatively healthy person, if you have a compromised immune system and such, or something like that, what does this mean for you? Do you just have to, stay apart for indefinitely, or what is the guidance for you?
I'll be happy to jump in there, Meg. It's a great question. I think everyone's going to have to make their own decisions about what risks they're comfortable with. Good news is now we have about 6 cases per 100,000 population in the state of Colorado. So when you walk out your door, the probability of being exposed to somebody is quite low. So your risk is low to begin with, baseline today. That can change with future potential increases in case numbers, but right now they're pretty low. And so everybody should say, well, given it's low, what am I comfortable with? I have an immune compromised person at home, so I'm going to wear a mask when I'm in a grocery store, or I might limit going to large events because I don't want to take even a small risk. Others might say, I'm comfortable with that risk and I'm going to live my life normally, even with a person with some immune compromised condition at home. It really becomes an individual decision about risk comfort. Recognize that right now our risks are all pretty low. Some have lower tolerance for any risk and will take extreme measures of protection, and others are more comfortable with taking on more risk. So it will be based on these individual decisions.
All right, let's go to Seth Kleiman.
Hi, Seth Kleiman from Megan. So CDPHE held a presser on this exact same day last year, talking about light at the end of the tunnel, vaccine had been out, cases were down. What makes this anniversary, the tone of y'all's perspective now different than that? And will we be here having this same sort of press conference in 12 months? Thanks.
I can start with that. The thing that we've seen in Colorado with this virus is it definitely goes down in the winter as, there's warmer weather, people go outside and kids get out of school. I think the thing that makes it different this time is that Omicron is, it's less severe. It's a disease that's less severe. We have a much higher level of vaccination in the state. There are great therapies available, antivirals and antibody treatments. And, Omicron is so contagious. The School of Public Health estimates that the beginning of January, between 1 in 10 and 1 in 15 and people in Colorado were infectious. So it's given us a layer of protection. And certainly, we've seen in the unvaccinated in particular, immunity wanes over time, but there is a level of protection right now. And all of these things have converged, I think, to put us in the best position that we have ever been in with this virus. I'll see if Dr. France has anything else to add.
I think that's right, Jill. We are certainly at a place, again, where the risk for an individual walking out their front door is much lower than it was a year ago. The fact that people are out and about and there are not increasing cases of hospitalizations suggests that there aren't a lot of people out there to spread this virus to. And so that suggests a very high level of immunity in our communities right now. And that level of immunity is quite a bit higher than it was a year ago, March 5th, 2021. So I think that has us feeling more positive about the short term and the low risk that our Coloradans have when they're out doing and living their normal lives.
Let's go with John Daly.
Hi there, John Daly, Colorado Public Radio News. Thanks so much for taking our questions today. I'm wondering if you could speak to the funding and how much do you estimate this next phase of dealing with COVID will cost the state, and how does that compare to prior funding? And do you feel like you have enough? Where will that money be coming from?
So, John, over the course of this response, the vast majority of funding has been pushed down to us from our federal partners. There have been, significant grant disbursements made, through our CDC channels. And then additionally, 100% FEMA reimbursement has been available, throughout the course of this pandemic for our surge activities. And so that FEMA funding has been extended through the end of June. And so we will continue to meet the needs of Colorado using that funding, and then we will continue to reevaluate as we move forward.
Let's go to Jennifer Meckles. Go ahead, Jennifer.
Hi, everybody. Jennifer Meckles from 9 News. I'm just looking for Colorado's perspective on a national issue I saw covered earlier this week when it comes to basically like the expired or leftover vaccine doses now that interest in the vaccine is so much lower than this time last year. Number one, what is the shelf life of a vaccine? Does Colorado have like a number yet of how many we've had to toss because they've expired or you couldn't use a full vial? And then just how do you manage that as a state, trying to make sure there's not too much waste when it can be prevented? Thanks.
Well, the good news is that our waste in Colorado has been lower than national experience. I believe just under 10% of all doses nationally have gone to waste. And, to give some perspective in that, we were encouraging people to be vaccinated. And if you had a patient in front of you at 6 o'clock at night that wanted to be vaccinated, and it required you to puncture a vial of 10 doses with the potential of wasting 9 doses in order to vaccinate that one person, we were encouraging that activity to occur. And so we would expect a certain maybe higher level of waste given the urgency of getting people vaccinated. Our own wasted weight rate as a state has been running around 4%, so more than half lower than what the nation has experienced. And I think that's because our care providers have been very careful about trying to make sure every dose counts and not waste doses. We've been very careful about making sure that we ship out those doses that are more likely to expire in the coming months. Each vial has its own expiration date, and at the state level, we can track those expiration dates. Sometimes they may be changed as the pharmaceutical companies understand the shelf lives are better over time. And so it's a constant management of inventory that helps us achieve a rather low rate of vaccine wastage in Colorado.
All right, let's go back to Alex Rose.
Hey there, Alex Rose again with Fox 31. Obviously, the president during the State of the Union announced a new approach with testing and treating. And obviously that announcement is just a couple days old. So I know the state doesn't necessarily have all the logistics of that federal program ready to go. But I am curious if anybody could talk about those antiviral treatments that Colorado has in stock. What does that supply look like? And can the average Coloradan expect to be able to go to a pharmacy or a health facility right now in the state if they test positive for COVID and be able to get one of these? Thank you.
I'm happy to jump in here again. We do get shipments every week of antiviral therapies. The numbers continue to be small, and we look forward to a day when the pharmaceutical companies are producing large numbers, and these are highly available in pharmacies prescribed by local physicians. And in the meantime, we're distributing our doses on a pro rata basis on population size. So areas with a lot of people will get more doses than parts of the state that have few individuals. I'm looking forward to seeing more about this immediate test and then treatment at the pharmacy. I'm sure there will be many requirements that you must not have this, that, or the other kind of condition, and only healthy individuals will probably get their doses through a testing and treating strategy. Those who may have other medical conditions, it would be wise that they meet with their healthcare provider to talk about whether the medication is right for them. So I know there'll be more coming to talk about the details of who will be qualified, who will be encouraged to see their doctor to make a shared decision with their doctor about treatment therapies.
Let's go back to Meg Wingerter.
Hello, this is Meg from the Denver Post again. When you were talking about the North Star of preserving hospital capacity, so it would be there for people with COVID, people who were having medical emergencies. And I wondered, we managed to do that, but people had to put off a fair amount of non-emergency care that was still important. So going forward, still the plan, or are you hoping to preserve a greater amount of capacity to deal with some of that important but non-emergency care?
Well, I think that is, the critical component of, the roadmap and moving forward is working with our hospitals, our healthcare system partners to ensure that we have the capacity to do all of the regular things and surge to meet any future needs of COVID or other illnesses. And so that is a key component of that roadmap and what we'll be working on as we go forward.
All right. Thank you, everyone, for joining today. Thank you, Executive Director Ryan, Director Bookman, Dr. France, and Dr. Travanti. If there are any questions we weren't able to get to during today's press conference, please email us at media_info@state.co.us, and we'll get back to you as soon as possible. Thanks again for joining. Have a great rest of your day.